and IBS. First of all, GERD is gastroesophageal reflux disease. The upward flow of acid from the stomach into the esophagus is the definition. Gastro means stomach, esophagus means esophagus, and eel means pertaining to. Reflux means a backward or return flow. When this occurs, the stomach acid irritates and damages the delicate lining of the esophagus. This is called heartburn. Occasional heartburn is not a problem, but a patient who experiences heartburn more than twice a week is diagnosed with GERD. It is seen most frequently in adults and is associated with alcohol use, pregnancy, and smoking. It is very common in overweight patients. Laparoscopic repair of the gastroesophageal sphincter may be recommended if lifestyle changes and medication are not effective. The most important concern with chronic GERD is the potential for developing Barrett's esophagus, a precancerous condition caused by long-term exposure of esophageal cells to gastric contents. Patients diagnosed with GERD are followed regularly by a gastroenterologist so that these abnormal cells can be detected early and removed before cancer changes occur. I didn't know before I did this that it could cause cancer, so this was very interesting.
We'll explain later more detail. Yeah.
Okay, IBS is irritable bowel syndrome. It's also known as spastic colon. It is a common condition of unknown cause with symptoms that can include intermittent cramping, abdominal pain, bloating, constipation, and diarrhea. This condition, which is usually aggravated by stress and by eating certain foods, is not caused by pathogens. That would be bacteria or viruses, or by structural changes. The diagnosis of IBS is made if the patient complains of recurrent abdominal discomfort of at least 3 months, abdominal pain that is relieved by defecation, feeling bloated, a change in bowel habits with constipation, diarrhea, and mucus discharge, and increased flatulence. The most common site of abdominal pain is the lower left quadrant. IBS is more common in women. It may account for up to 50% of referrals to gastroenterologists because of concern of possible organic disease. The syndrome is associated with food intolerances, menstruation, and stress levels. Treatment is primarily pharmaceutical with bulk-forming agents like Metamucil, given for constipation, loperamide, which is Imodium, or diphenoxylate, and atropine, which is Lomotil, for diarrhea. Lactate if the patient is lactose intolerant, as antispasmodic agents for cramping, and anticholinergic agents for bloating. Alternative therapies include acupuncture to relieve cramping and improve bowel function, and herb peppermint to relax intestinal smooth muscles, and probiotic foods such as yogurt to provide bacteria that make up the natural flora of the intestinal tract.